judges, my name is Terry Kinsella.
And I'm Dante Collazo.
I'm Victor Coronado.
And I'm Ali Garcia, and we are the Senior Skills Team FFA chapter at the Center of Career and Technology.
The skills that we will be performing today are placing a canine patient under anesthesia for the purpose of a dental cleaning,
Proper and safe intubation of a patient,
Explaining the mathematical conversions required to properly calculate pre-anesthetics and induction medication.
Performing a basic dental cleaning using common veterinary dental tools.
proper and safe extubation and patient recovery,
Dental prophylaxis is a common procedure done daily in small animal veterinary clinics. Preventative dentistry is important to maintain good health and quality of life in pets, just as it is for humans.
veterinary technicians and assistants play an integral role in providing care for our patients by scaling and polishing their teeth.
This is why this skill is so important to us, that we are training to be future veterinary assistants.
And by the end of this demonstration, we hope that you may also appreciate and understand the benefits of a veterinary dental clinic. So, the teaks covered in these skills are from the veterinary medical applications C1B, 1C, 5B, C through E, 7B, 8A through F, and 14A and B.
Proper safe anesthesia requires a general knowledge of general anesthetics. Proper and safe intubation also requires a general use of an intubation tube, but these steps will be outlined step by step later on.
And in order to properly perform a dental prophylaxis, a technician must have a basic understanding of dental anatomy, dental charting, tools, and their functions.
The tools we will be using for today's procedure are PPE, hand dental tools, pre-meds with syringes, induction meds, mouth speculum, and ultrasonic scaler. Our patient for today is Frankie. He's a 5-year-old male neuter and is coming in with moderate periodontitis and a bit of tartar on some of the teeth. He also weighs 53 pounds.
Okay. So the very first thing we did is we pre-calculated the amount of butorphanol and acetylpromazine we needed for our patient, and it was 0.48 mg of butorphanol and acetylpromazine. These are our pre-med medications, which helps us get our patient into the anesthetic process. And as acting anesthesia technician, Tara will administer these two medications.
Okay, so for today, we're going to be inserting the needle into the cranial thigh muscle, but we're going to be doing it right here. So in order to insert the medication, you're going to take off the cap safely, and then you're going to pinch the cranial thigh muscle. You're going to insert the needle perpendicularly while pulling back to make sure there's no blood. If there is blood, then you need to relocate, but there's not. So we're going to insert the medication, and then we're going to take out the needle, rub the wound, and then insert the cap safely. Now we wait 30 minutes to make sure the acetylpromazine and butorphanol take effect.
So while we're waiting for the acetylpromazine and butorphanol to take effect, the technician will usually administer the amount of propofol needed for our patient. But before we can do that, we must convert the patient's weight up to 53 pounds into kilograms. And to get that, you're going to multiply the 53 pounds times the 2.2 kilograms is going to give you 24 kilograms. Okay, now we're going to use the recommended dose of propofol for our patient. So you can multiply our 24 kilograms times the 2 mg, that's going to give you a total of 48 mg for our patient. Okay, so next you're going to use the concentration of propofol in this bottle, which is 10 mg per milliliter. So you're going to multiply the 48 mg times 1 milliliter. It'll give you a total of 48 milliliters, but you're also going to divide it by the 10 mg, give you a total of 4.8 milliliters. From there, you're going to put the 4.8 milliliters of propofol into the syringe. You can open the syringe. You're going to put 4.8 milliliters of air into the syringe, so right there. And from there, you're going to insert the air back into the bottle. Once you insert it into the bottle, you're going to flip it around and get your propofol 4.8 milliliters, or cc's, of propofol into your syringe. Once you get the right amount, you're going to flip it back over and move it down the bottle. Recap the syringe and flick it to remove any air bubbles. As you can see, there's no more air bubbles in our syringe. From there, we are going to administer the propofol into the patient's mouth.
So during this process, I will be restraining our patients. So we will be placing the patient on sternal recumbency, which is on its chest.
We're going to safely remove the cap, and then you're Right now we want to get a relaxed jaw tone. So right now you can see his jaw is kind of tense. He had blink reflex and that's not what you want. You want him to be relaxed so you can intubate. So we're going to insert 1 cc. We're going to insert about half of our propofol. And after that you can see he's relaxed but not enough to where we can intubate. So he still has a blink reflex and now we're going to insert maybe 1 more cc of propofol. After that, you can see he's now ready to intubate. Now we're going to undo the needle, and then we're going to recap safely.
Now we will be placing the dog on its side, which is called lateral recumbency.
Now we're going to take it back up for sternal recumbency. So to get the correct size of the endotracheal tube, we're going to measure it from the point of the shoulder to the incisor tube, right here. So as you can see, this is the right size, but another way to check is to put it in between both nostrils. As you can see, it fits in between both nostrils, and that is the correct size. So now we're going to intubate. First, we will need a laryngoscope. The laryngoscope facilitates visualization of the glottis as the tube passes into the trachea. After that, what you want to make sure is that the tube is not too big, otherwise it will damage the larynx and trachea. If it's too small, the patient will have trouble breathing and will have aspiration. Then you're going to tie it to the top canine because this dog has a long muzzle. If it has a short muzzle, then you tie it to the bottom jaw or around the ears.
So during this process, I was restraining the dog by holding the top portion of the jaw at the canine and pulling down the bottom portion, so we can give Madeline a clear view of the throat.
After that, we're going to inflate the cup. We're going to insert 4 cc's of air. We don't want to insert too much because then, as you can see on the board, it will damage the throat. On the left side, you can see that is the correct size. However, on the right side, that is damaging the throat. So now we're going to be putting him back on lateral recumbency.
And I will be tapping on its chest, making sure we don't hear any abnormal sounds, which we don't. So then after this, we will connect our patient to the proper monitoring device.
And you'll be given a consistent flow of anesthesia that we connect to the endotracheal tube.
So a piece of important monitoring equipment is the pulse oximeter, which is used to measure the pulse rate and the amount of oxygen in the blood of a patient. We'll be placing the probe of the pulse oximeter on the tongue of Frankie here.
But to show you how it works first, we're going to put it on Josh's finger. So as you can see, this will measure his blood oxygen levels and his beats per minute. If this had been placed onto the canine patient, a normal range for the blood oxygen levels would have been 95%, and normal range for the beats per minute would have been 75 to 80. And as you can see, Dante's blood oxygen levels are 94%, and his beats per minute are within the 80s, 81. Okay. So once we have Dante's beats per minute and blood oxygen levels, we can place it onto Frankie's tongue.
From here on out, I will be the anesthesia technician. I will be making sure the patient is stable and vital signs are within normal limits.
So before we begin the exam, we want to use an oral speculum, which should be placed on the canines to hold the mouth open. It should be noted that in recent veterinary studies, it's been recommended that veterinarians use a softer and safer method than the spring-loaded mouth gag.
So during this process, as you saw, we came in with gloves. This is to protect the patient and ourselves. This is known as an item of PPE, or also known as a personal protective equipment. Other pieces of PPE are face masks, eye protection, and exam gloves. These are very important for a dental procedure as bacterium is commonly aerosolized and can be very hazardous to our health.
Another thing you should know about is dental charts. There are many options for the type of dental chart a veterinarian can use, which is why we chose this particular chart here. You want to make sure to keep a dental chart neat and organized, as findings are part of a medical record, making them also a legal document. And when covering the teeth, you want to make sure to cover both the lingual surface of the teeth, which is the side of the teeth facing the tongue, and also the facial surfaces, which consists of the labial surface, which is the side of the teeth facing the lips, and the buccal surface, which is the side of the teeth facing the cheeks. The very first thing you want to do with the dental chart is to first write down the patient's name and date. Then we will check for halitosis, which is bad breath.
Oh man, Frankie, that breath stank.
Then we check for any plaque and tartar, which there is a mild amount of. We can see that Frankie is missing a tooth at 205, or the first top left premolar. Then we check for any fractures, which Frankie has none of, and he has gingival inflammation and a normal occlusion. Another thing to check for is tooth mobility, which is measured on a scale of 0 to 3, of which the 203, or the top left third incisor, is showing signs of slight mobility, so we will chart this down as an M1. Another very important thing to check for is gingival recession, and that is done with a periodontal probe.
So periodontal probes are used for gingival recession, as you mentioned. And so they are measured in millimeter increments, as you can see on the periodontal probe. There are also various types of these tools.
So tooth exposure below the gum line can lead to periodontitis, which is defined as a severe gum infection that destroys the gums and the jawbone. With that being said, the final step would be to grade the level of periodontitis on a scale of 0 to 4, of which Frankie has stage 2 periodontitis.
So during the process of dental charting, we have used various types of tools. One of the dental tools we use is the curette, and this is the curette. It has one blade with 2 cutting edges. It is used for root planing, curettage, and to remove any excess tartar. You would go under the gums and scrape any of the tartar that is left behind. Then we also use the hand dental tool. And this is a hand scaler which removes large bulky calculus, and you just scrape amongst the teeth like that. So then after this we would scale the teeth.
Okay, so to scale teeth, we're going to use an ultrasonic scaler, which is this lovely machine with many parts. So this tool is a newer scaler, and it works through the vibrations of the metal stacks. It moves at 45,000 hertz. And also, because the glucose gas is a continuous emission of aerosolizing water spray, this means any bacteria, plaque, particles that was on the teeth is going to be aerosolized and released into the air. That is why the technician or doctor who is cleaning the animal's teeth should be wearing a face mask or goggles, so you don't want to see any bacteria entering any of your facial cavities, because it can cause harm. As you can see, he is moving the ultrasonic scaler in up and down motion. This is the recommended way to use it. It removes most of the unwanted materials off of the animal's teeth.
So then after we have scaled the teeth, we will now polish our teeth. So this is the polishing agent we will be using for today. And you will place some of it on the brush, just like this. Just very little. And then you are going to place it on the tube. And the reason why we polish the teeth is to remove any stains and or tartar that has been left behind after the scaling. You are going to go in a circular motion to remove any of those stains. So as you can see, Frankie's owners have not brought him to the dentist enough, but after polishing the teeth should be clean. So then after this, we will now extubate.
So first thing to remember when extubating the patient is to remove them from the flow of anesthesia and to remove the tool. So once the patient is removed from monitoring equipment and the flow of anesthesia, you want to check for a physical response from the animal, which can include the animal blinking or swallowing 3 times. Once Frankie has shown a physical response, Tara is going to untie the gauze of the endotracheal tube. So you want to remember to keep the animal's mouth off of the edge of the table, so any material that had been removed during this scaling, if it had fallen down the throat, it now has a place to fall out. So she's going to deflate the endotracheal cuff. She's going to slowly slide it out of the animal's trachea. She wants to remember to do it slowly because you don't want to cause any harm to the animal's trachea. So once the patient is safely extubated, we're going to proceed to patient recovery. So the first thing you're going to do is wrap the patient into the blanket. Remember, when you're picking them up to keep all of their, keep them even, you don't want to cause any harm to any of their bones. So you put the patient onto a recovery mat or in a kennel. So make sure the patient stays nice and neatly inside their blanket. You don't want them to lose any body heat. One thing to remember is that you can put rice bags on the side to help them stay insulated. You don't want to put any electronic heating devices next to their skin because it can burn. So once the patient has been given back to the owner will be given all this home care products, which include a toothbrush, some enzymatic dog toothpaste, and an oral rinse. You will also be given this packet to talk about what happened to your patient today at the veterinary clinic.
So I just want to state something. So as you saw, we were cleaning during the procedure, and this is important just to make sure that your space is organized and clean. So throughout this presentation, we have talked about the step-by-step process of how to perform a dental cleaning with the use of anesthesia. Anesthesia is an important aspect to this procedure because it serves as a passageway into the lungs. And it is important because an awake animal will not be in a stable position for the technician or the veterinarian to work on it. A veterinarian or technician should be educated on these drugs. The drugs we used during this procedure were acepromazine and butorphanol, which served as our pre-anesthetics, and propofol, which served as our induction agent. After we anesthetized the patient, we then intubated it, which serves as a passageway to the lungs and serves as a blockage from any liquids entering the lungs. After this, we then plugged in the patients to the proper monitoring equipment, which is very important.
Then we proceeded with probing, dental scaling, ultrasonic scaling, and tooth polishing. It's important to remember to brush your dog's teeth on a regular basis, as poor dental health can lead to cardiac diseases. So, with that being said, it's important to remember to keep your dog's teeth clean and brushing them on a regular basis, and also to schedule at least a yearly dental appointment with your veterinarian. And thank you for your time.
Thank you.
Thank you.